They estimate, nobody really knows for sure, that 3 to 5% of the world's population has some kind of disability, intellectual disability. That means that over 11 million people globally have an issue. And that means that those people are not getting the care that they need because there aren't enough physicians that are either trained or have the inclination to see this population.
There's a huge misconception that these folks are healthy and we can leave them alone. On the contrary, we really need to be watching them. I mean, they do have quite a few secondary, so if your primary disability is let's say Down syndrome, the secondary disability would be at the age of, let's say, 40, you have a cardiovascular risk that's much higher than someone your age.
Healthy Athletes is a program for people with learning disabilities to get checked up. You get your hearing checked, get your feet checked, get your eyes checked, and it's very important because some of them don't get good insurance, so it's very important.
I think of it as a screening, a way to get people in the door, a way to identify problems or counsel people about problems that they might know exist but not really know what to do about them or where to get help from.
We started just to assess athletes' sports visual skills. Wanted to see eye-hand coordination, eye-foot coordination. What we found is that about 30% of the athletes will need some kind of change or update in their glasses. About 18 to 20% of them have some kind of mild or chronic or acute health issue. Many of these athletes have cataracts. It's quite astounding to us that that there's this need, because it means that the access to care or the access to very good care for this population has not stepped up yet.
Athletes, as they age, decide they don't want to run around the track anymore. Unified Sports Fitness, it was thought of to be a way to get older athletes to continue some form of physical activity. So this was, let's get them away from the television, let's get them away from the games, and let's give them something that will be social and active to help with their health.
Fit5 empowers athletes to live healthier lifestyles, and also it wants to link the idea that the healthier you are, the better athlete you are. So when you improve your fitness, you improve your sports performance. So the idea is to empower athletes to do that. The premise of it is that health has a holistic approach, so you should be exercising, eating properly, and hydrating properly, especially as an athlete.
Our population is a massive population, so it is the largest group of people with disabilities in the world, and so if you're in healthcare, you best be prepared in the future, because you're going to be working with people who have intellectual disabilities.
There still is a deficit in most medical curricula for working with this population. And so my advice would be to not only pursue working with this population, but to also give back to whatever institution you have been in to make sure they include it in their curriculum.
It's hard to get experience as a student clinician with this type of population, and this really provides the students a chance to just get comfortable. It can be uncomfortable, I think, sometimes. It can be uncomfortable for professors to teach about it because they might not know. And here we have a great organization in Connecticut that we have access to. Every student in every discipline should involve in at some point.